Welcome, everyone. Today we're diving into something really practical and honestly super important. The actual words nurses use every day. We're looking at some key English phrases.
That's right. We're talking about those common, maybe even basic sounding phrases. But they're not just throwaway lines, are they? They're really fundamental tools.
Tools for what exactly?
Well, for building trust, figuring out what a patient needs, and just making sure people feel safe and comfortable. Clear communication in healthcare, it's just critical.
Yeah, and it's interesting how good communication actually helps patients understand things better, helps with their health literacy, you could say.
hmm
When nurses communicate clearly, patients feel more empowered.
Exactly. It's not just about being polite. The words nurses choose, how clear they are. It genuinely affects how well a patient can grasp what's happening and, take part in their own care.
Okay, so for this episode, let's really unpack 5 specific English expressions that nurses use all the time. We want to get into why they're important and how they work in real situations.
Sounds good.
5 phrases we're focusing on are, how are you feeling today? I'm here to help you. Please let me know if you feel any pain. Oh, I'm going to check your vital signs. And do you have any questions or concerns? Ready to start with the first one.
Let's do it.
All right, so how are you feeling today? Seems like just basic politeness, right? A standard greeting.
It does, yeah, but in a hospital or clinic,
Mm-hmm.
it's doing a lot more work. First, it immediately shows you care about the patient as a person, not just a case.
Right.
And second, it's an open door. It invites the patient to share, how they're doing physically, but maybe emotionally too. It kicks off the nurse's assessment.
And the example often given is something like, good morning, Mrs. Smith. How are you feeling today? Very direct, very personal.
Exactly. And the key is really listening to the answer.
Mhm.
Whether they say, oh, I feel a bit better, or actually, I'm still really tired, or I've got this pain in my leg.
Mm-hmm.
That simple caution opens up the conversation to get that vital information. You learn things that might not be obvious just from looking at a chart. Careful listening is essential there.
And it circles back to building trust, doesn't it? Showing you're interested in their well-being overall, not just the medical data, that human connection.
It really is. It sets the foundation for everything else.
Okay, let's move to the second phrase. This one feels really comforting. I'm here to help you.
Yeah, it's significant because it's so direct. It tells the patient straight up, my job is to support you, to care for you. And think about when that's especially important.
When someone's maybe scared or confused.
Exactly. If a patient seems worried or anxious, this phrase can be incredibly reassuring.
And the example often includes something like, don't worry, I'm here to help you. If you need anything, just call me.
And that extra part, if you need anything, just call me. That really reinforces the message. It works together with, I'm here to help, to hopefully reduce some of that anxiety. It kind of gives them permission, encourages them to speak up if they need something, anything at all, without feeling like they're bothering you.
That makes a lot of sense. All right, phrase number 3. Please let me know if you feel any pain. This one's obviously tied into a huge part of nursing care.
Absolutely. Pain management is critical. And this phrase, it's proactive. You're asking the patient directly to report pain or discomfort. Why? Because you want them to tell you early.
So it doesn't get worse.
Right.
Yeah.
Addressing pain quickly is vital. It prevents suffering, obviously, but also potential complications. So the phrase is polite, but it's also a clear instruction. Tell me if this hurts.
And the example, like, please let me know if you feel any pain or discomfort during the procedure. That situates it right in the moment, managing expectations.
Precisely. It lets the patient know their comfort is a priority, even when something potentially uncomfortable is happening.
Uh-huh.
And it also implies the nurse is ready to act on that information. It's not just asking, it's about monitoring carefully and responding quickly when a patient does report pain.
Okay, number 4. This is one everyone's probably heard if they've been to a doctor or a hospital. I'm going to check your vital signs.
Yep, the standard phrase before taking blood pressure, pulse, temperature, breathing rate, all that.
So what's its main job, communication-wise?
Preparation and transparency, really. It simply tells the patient what's about to happen. No surprises.
Right.
It's just good communication practice. Professional. It makes the whole thing feel less, intrusive, because they know what you're doing and why.
And the example is straightforward. I'm going to check your vital signs now. It will only take a few minutes.
And that little addition, it will only take a few minutes, that's actually quite important.
Oh, yeah. Why is that?
Well, giving even a rough time frame helps patients feel more comfortable, maybe a bit more in control. They know what to expect duration-wise. It's a small detail, but it can really help put someone at ease.
Good point. Okay, and the fifth phrase, often used near the end of an interaction. Do you have any questions or concerns?
Ah, yes. This one's crucial for closing the loop. It's an explicit invitation for the patient to bring up anything they're unsure about, anything worrying them.
So, making sure nothing gets missed.
Exactly. It encourages that open communication. It helps ensure the patient feels heard, informed, and like they're actually involved in what's going on with their health.
And the example could be something like, before I leave, do you have any questions or concerns about your medication? Very specific, very helpful.
It is. It's a polite way to wrap things up, but it also shows you value their understanding and their perspective. It keeps that communication channel open right until the end of that particular conversation.
Now, seeing these phrases laid out is one thing, but how do they actually work together? There's often a bit of a role play example used to show this.
Yeah, those are useful because they show the flow. You see how these aren't just isolated sentences, but part of a natural back and forth. Imagine a typical nurse-patient chat.
Okay, let's walk through it. The nurse might come in and say, "Good morning, Mr. Johnson. How are you feeling today?"
And Mr. Johnson might reply maybe, "Oh, a bit tired, and I've had some chest pain."
Right. So the nurse, hearing that, might then say, "Okay, I'm here to help you. Please let me know if you feel any pain or discomfort during the exam."
Acknowledging the pain, offering help, and setting the stage for assessment.
Then moving on. "I'm going to check your vital signs now. It will only take a few minutes."
Standard procedure, clearly announced.
After doing that, the nurse might say, "All done. Before I go, do you have any questions or concerns?"
Opening that door one last time.
And in this example, Mr. Johnson does have a question, maybe about his medication, and the nurse can then explain it.
Yeah, you see how smoothly those key phrases guide the interaction. From greeting and assessment to reassurance, explaining procedures, and finally checking for understanding. It flows.
It does, and apparently practicing these is encouraged.
Absolutely. Saying them out loud helps make them feel more natural. It's about clarity and confidence. Sometimes people suggest just repeating them. Maybe we can do that quickly. Just listen, think about the meaning, maybe say them after us.
Okay, first one. "How are you feeling today?"
I'm here to help you.
"Please let me know if you feel any pain."
I'm going to check your vital signs.
And "do you have any questions or concerns?"
Simple phrases, but really effective when used thoughtfully.
So, wrapping up this episode, we've explored these 5 common but really essential English phrases for nurses.
And the main takeaway, really, is that good communication isn't just a nice to have in nursing. It's fundamental. It's about providing great care, making patients feel comfortable and safe, and building that crucial trust.
It's amazing how much impact these seemingly simple words can have.
It really is. And, thinking back to that idea of health literacy, how patients understand health information. Maybe a final thought for you listening is this. How do these basic, clear phrases do more than just convey information? How do they actively help patients feel more able to understand, to ask questions, and to participate in their own care? It's not just what is said, but how it empowers the person hearing it, something to ponder.